But let's jump right into this with a few words of introduction for a man who needs no introduction. Isn't that the classic paradox? You know, all the people who don't need any introductions are the ones getting them. But in reality, Rabbi Professor Dr. Eddie Reichman is really a unique luminary, I would say, in our times, who sits at the very intersection of Torah law, medical ethics, and is one of the world's greatest voices and scholars on the intricacies, the complexities, the intersection, and the overlap of Torah and science. And beyond all of the wonderful accolades I can give you, Dr. Professor Reichman, I think having gotten to know you somewhat up close when you were here some months back, I would have to say that both you and your Rebbitzin and your dear wife, who is an extraordinary mind in her own right, without a doubt, are rare and refreshing in as much as you literally embody the highest values of Yiddishkeit, of Torah Judaism, embodied by that wonderful teaching, that Derech Eretz Kadma LeTorah, which means that decency, civility, compassion, humility, kindness, and authenticity, these are all part of the building blocks, as it were, the foundation or the soil in which the riches of Jewish spirituality take hold and flourish and sprout into life-giving and fruit-bearing trees. And so on that note, I must say I was so taken by the personal example of integrity and sincerity and authenticity that you both embodied. And so that's my little 2 cents, my own personal accolade, which could really be added to many more of the sort of professional achievements, accomplishments, and titles that you have and you possess. So without further ado, we're going to be jumping right into a very pertinent topic, of course, the topic that's on many of our minds and close to our hearts, and that is the topic of pandemics, and in particular, what is the Jewish approach historically to pandemics? Without further ado, Professor Eddie Reichman, followed some remarks, followed by Q&A.
Thank you so much, Remendel. Tremendous schus to be with you today, as it was just a few months ago, and it's hard to believe that it was December that we were together in London. It is a different world.
How quickly the world can literally change.
The world has changed irrevocably since that time. It seems like an eternity ago, but I got a chance to spend a wonderful few days in your community to see what the ideal Rav is, the Rav that has a kesher with his community in ways which are really extraordinary, a true role model of Torah and an ability to relate to people on a very personal level. It was a very humbling experience, a very educational experience for me and Sarah to spend in the community. And we got a chance to meet some wonderful people and to see what a real ideal Jewish community should be and can be. Mirza Hashem should continue like that for many healthy, happy years.
Amen.
Since these last few months, it was really just a few months after I left London that we were all introduced to a word that we weren't so familiar with called coronavirus, subsequently COVID-19, and lives changed for all of us. For some more than others. My personal job is an emergency room physician. I work at one of the largest hospitals here in New York called Montefiore Medical Center. And obviously for me, things changed quite radically. I began to be exposed to a disease which I had never seen, none of us had ever seen. And one of the most frightening aspects is the fact that it's a potentially fatal disease. Disease which, as we now know, has had quite a significant fatality across the globe. Montefiore, where I work, has seen many, many patients of this particular COVID. Just last week, we discharged our 5,000th patient of COVID-19. And there were some very trying and challenging and difficult times. Baruch Hashem, we seem to be on the other side of the curve. We in the emergency room saw a number of fatalities, Rahman al-Islam. And I was speaking yesterday to a medical resident who works on the medical floors, and it's slightly different than in the emergency room. And he said that he was the code physician for in the midst of the pandemic, which means that if there was a cardiac arrest, he would be called to the bedside. And he said on his most difficult night during that pandemic, and clearly the most difficult night of his life, he ran 26 cardiac arrests from the time he came in the evening until the time he left in the morning.
Wow.
And unfortunately, none of those patients actually survived. So it's quite, we've seen quite a bit here in New York. We are the epicenter of the United States. We've seen an extraordinary number of cases, and tragically, we've seen an extraordinary number of victims who have not survived. For me personally, as a Jewish physician, I was encountered with some challenging halachic Jewish legal issues. One of the first issues which crossed my mind when I learned about the fatality of the disease and the fatality for people who are older and not so young anymore, I was genuinely concerned about walking into that environment, exposing myself to the possibility of contracting a disease which I wouldn't survive from. And in fact, in Jewish law, there are extensive discussions about how much risk one should incur in order to save the life of another human being. And we have an obligation of lo ta'amod al dam re'echa, to save the life. Don't stand idly by as the blood of your brother is being shed. And in fact, a physician, interestingly, according to Jewish law, may have an obligation to accept a higher risk than the rest of the community, or any healthcare worker for that matter, might have an obligation to accept a slightly higher risk to save human lives than others. But how much is that risk? Should I be putting myself in an environment filled with COVID patients every single day, knowing that there's a high likelihood that I could contract this disease? And I was about to approach one of the great rabbinic authorities of this generation, Rav Asher Weiss, and ask him this question: am I obligated to work in this environment? Am I prohibited from working in this environment? Am I permitted to work in the environment if I so choose? And it turned out that I myself contracted COVID-19. And I contracted it probably the end of March, beginning of April. I was out for a number of weeks. Baruch Hashem, as you can see, I survived COVID-19. I had, I guess, what you could call a medium version of COVID-19. Of course, many people had much worse than me, but I was bedridden. It was clearly the worst illness that I've ever experienced in my lifetime. And it was the challenging aspects of it were also that you're in isolation. So I had to go to the hospital only for a brief time for an emergency visit, but I was able to spend most of the time at home. But you're in isolation. Your own family can't even take care of you because they'll get exposed if they come into the room. So it was a very, very trying time emotionally and physically for me. But Baruch Hashem, as I said, I'm on the other side of that. But these questions are halachic Jewish legal questions. How much risk should one take? And an interesting question which came up in the pandemic also was, you as a healthcare worker might want to take the risk, but when you come home at night, you're exposing your family members. And let's say you have a family member who has a disease that could affect them more seriously, is immunocompromised, so to speak. Are you permitted to take that risk and then come home and expose those in your own homes? And those were many shilas which were asked. Those Hatzalah members, we in New York, in the United States, have Hatzalah, which is a Jewish ambulance corps, and many of them were going and encountering patients with COVID and then coming back home. Many healthcare workers, physicians, and nurses and nurse practitioners, many of them ended up not even sleeping at home, not even coming home, or sleeping in a separate bedroom and not having much contact with their families. Very difficult and trying times. The community also, the medical community also encountered something for which Jewish law had much to say, and that's the question of triage, the question of not enough respirators. You're encountering dozens and dozens of people that required mechanical ventilation, and there was fear we wouldn't have enough respirators. These are major halachic questions which the secular world obviously was facing, and the Jewish authorities were also facing. And what I'd like to do now for the next few minutes of our presentation is to turn to a PowerPoint that I have, and to share with you some of the fascinating parallels and comparisons from this century and to previous centuries, which I think will give us an important historical perspective. We've all experienced the here and now, and there's one word which comes up incessantly in the description of this particular pandemic, and that word is unprecedented. There's one word, I think, if it wasn't in our vocabulary before, it's in all our vocabularies now, and that's the word unprecedented. And indeed, this is an unprecedented pandemic. And I'll show the map. This is from just a few hours ago. The dashboard, the COVID-19 dashboard, 5.5 million people now currently afflicted with the disease. Roughly 350,000 people have lost their lives. And it is unprecedented in the sense that it has affected the entire globe virtually simultaneously, which is something that hasn't occurred in previous pandemics. But what is also unprecedented in the Jewish legal world is the fact that in previous centuries, as we'll see momentarily, when rabbis rendered decisions about pandemics, they wrote them down by hand. They were later published if they were in a post-publication period after the advent of the printing press. And they were only printed years later, and only subsequently were we able to get an insight into what the rabbis had to say about very difficult, challenging times of disease, epidemics and pandemics. But today, it's very different. Today, the rabbis are rendering decisions, and we actually are privy to those decisions almost in real time. They write down the decisions, they're posted on the internet. They've gathered, a number of the great rabbinic authorities have gathered them into PDF volumes, which I'd be happy to send to Reb Mendel for you to read. Some of them are in English. It's really an extraordinary historical record. This is Rav Asher Weiss, one of the great rabbinic authorities in Jerusalem, who has written an entire 170-page volume on responsa questions from coronavirus, Piskei Corona, the Jewish legal decisions of Corona, from Rav Hershel Schachter in Yeshiva University. Rabbi Dr. Avram Steinberg has written a magnificent piece collecting all the medical and non-medical issues related to Corona, and Rabbi Rimon also in Israel. But even though they are addressing these issues, one might think, if one didn't have historical context, that all these issues that they're addressing for the very first time. And my objective is to show that while it is true, there are many unprecedented dimensions, there are indeed many precedented, if you will, aspects of this current pandemic. And here's just a list of some of the pandemics over the centuries, dating back to 165 to 180, the Antonine Plague, Black Death, which you're all familiar with from the 1300s. This one I bring your attention to, and I'll show you some interesting ramifications of that as well. The Great Plague of London in 1665. And I suspect that in your media, and I know because I've read from your media that they have referenced this Great Plague of London, because that's the historical context. That's the last great pandemic of London, which they are paralleling and comparing. An Italian plague, which we'll reference, cholera pandemics spanned, or 6 cholera pandemics spanned from the early 1800s to the mid 1900s. And others, the Spanish flu here in the United States, we talk about all the time, 1918, 1919. And of course, in the very modern era, AIDS and SARS and Ebola, and of course, COVID-19, which now is prominently placed on this list as well. What I'd like to do for the next few minutes is to share with you some of the modern responsa. And this is a picture of a physician in a hazmat suit. And this actually happens to be a picture of me in my hazmat suit from Montefiore Medical Center. And I'll share with you these responsa, and then I'll contrast them or compare them to responsa in previous centuries. And this is a plague physician from previous centuries wearing very similar outfit, long gown, gloves, covering the face, etc., etc. Wow. Back in March, just 2 or 3 months after I had the great pleasure of joining you in London, the World Health Organization declared that the coronavirus outbreak is a pandemic. Pandemic is a disease outbreak that not only is restricted to a specific geographical location, but moves outside that geographical location to other countries. And in fact, as we have seen, it has spread virtually throughout the entire globe. If we look to the Talmud thousands of years ago, we find that the Talmud also had a need for a definition of pandemic, if you will, or the spread of disease. And the Talmud in the Tractate of Tanit says, "V'chein ir sheyesh ba dever," and so too a city which has plague. What does that city do? That city should fast, take upon themselves a community fast, and they should sound a blast of the shofar. How do you define that? So the Talmud says, what's your threshold for the definition of dever, of plague? If a city that can supply 500 foot soldiers and 3 deaths occurred on 3 consecutive days, behold, this constitutes a plague. Less than this is not a plague. So even the Talmud had its requirement for a definition of plague. Sheltering in place. I'm not sure if you use in England the same expression, the same terminology, but here in the United States, sheltering in place is something which has been done in many states across this country, basically to stay at home, the requirement to stay at home. Is this something which has precedent in history? During the plague, also from the Talmud, thousands of years, Bava Kama 60b, the sages taught, Dever bo'ir, if there is a plague in the city, gather your feet, kanes raglecha, limit the time you spend out of the house, stay at home. But this wasn't necessarily agreed upon. And many people suggested the opposite advice. And this is from Moshe Isserles the Ramah, one of the great rabbinic authorities from the 16th century, who wrote, "Sheyesh livroach min ha'ir keshedever bo'ir." One should flee the city when there is a plague. One should leave at the beginning of the plague and not at the end. And he himself recounts in an introduction to a book he wrote about Purim, about the Megillah, that he was in Krakow and there was a plague in Krakow and he was forced to leave and go to the city of Shidlov during the course of the plague. An example from your side of the pond. There's whether fleeing was the custom or whether one should kanes reglech or should shelter in place. Back in the time of the Great Plague of London, Chacham Jacob Sasportus, who was one of the religious heads of the London synagogue, wrote a letter in July of 1666. These are the words of him who writes and signs here in Hamburg in Germany, and who fled from fear of the destroying hand of the Lord, which was against our community in London. So Jacob Sasportus, who was the leader of the Jewish community in 1665 when the plague broke out, he fled. He fled and he went to Germany. Keep in mind, I don't need to school you in British history, and I could learn much from you. But 1665, 66, there weren't that many Jews in London. This was only a few years after the Jews had been let back into London by Oliver Cromwell, and the community wasn't such a large community at that time. Wearing a mask is something which we are required to do now if we leave our houses and we go into the streets. Leave it to an Israeli to design a mask with an opening where the mouth is, with a remote control so you can open it up and eat at the same time. Wearing masks also has precedent in rabbinic literature. The tzarua, the one who is afflicted with tzaraat, the disease tzaraat, the biblical disease, which afflicts people for speaking lashon hara, for speaking evil gossip. What does it say about the tzarua? Bigadav frumim rosho yefarua, his head should be left bare. Be'al safam ya'ateh, and he shall cover his upper lip. And the Ibn Ezra commentary from the Middle Ages says, why does he cover his upper lip? Vatam shelo yazik beruach piv. He shouldn't infect other people with his contagious disease. Tsaras was a contagious disease. And many centuries later, the Chafetz Chaim, the author of the Mishnah Brura, writing in the laws of Tisha B'Av about fasting on Tisha B'Av, he writes that during times of plague, if someone wants to fast, they should be extra cautious For sure, if they're afflicted, they shouldn't be fasting. But if they're healthy and they want to fast, they should take precautions. And he writes, "Shelo yelech mipesach beisa kol hayom." But if he shouldn't leave his home. But if he wants to leave, yisa saviv lechatma upiv chatichat camphor. If he wants to leave, he should put near his nose and his mouth a piece of camphor, probably in some sort of mask, to protect him. Camphor was thought to be protective for plague even back in the times of the Black Death. It's a chemical substance, a wax-like substance with a strong odor as well. Coronavirus and isolation. Isolation, this is the Center for Disease Control in America, defines isolation as used to separate people infected with the virus from people who are not infected. And I have admitted many people to the hospital for coronavirus that have required isolation so they don't cause disease for other people. Tsaras is another example of isolation. The Torah even tells us, one who is afflicted with tsaras, badad yeshev michutz lamachaneh. He shall dwell apart. Badad is alone, in isolation. His dwelling shall be outside the camp. And one of the rabbinic commentaries writes, Badad Yeshev, why should he sit alone in isolation? So he doesn't infect other people who would come to visit him and contract the disease. Here I share with you one of the more remarkable works of Jewish history relating to plague. And this is a work by Avraham Kadlano, who was a member of the ghetto of Padua in the midst of a plague, one of the Italian plagues in Padua in 1631. There were 4 people that were in charge of the community. He was in charge of the financial aspects, the medical aspects, the halachic aspects. And he writes about isolation. And this is he wrote a work called Olam Hafuch, which is world in upheaval. And he wrote about his personal experiences during this time. And it's basically a diary of what he encountered, and it's really a very moving and enlightening diary about how the Jewish community addressed the pandemic in those days. And he wrote, we in the Jewish community began to build our own lazaretto. What is a lazaretto? Lazaretto is the Italian term for a house of isolation, where patients who are afflicted with disease would have to be sent there to dwell until they would hopefully recover. And unfortunately, many people went to the lazaretto, did not survive the lazaretto. And the health officers declared that if we do not build our own, the Jews will be required to stay in the city lazaretto. And there were issues with that, because you wouldn't have access to kosher food. There's even a responsum whether you're required to put a mezuzah in a lazaretto. And the psak was, the opinion was that since a lazaretto by definition is a temporary dwelling, you would not be required to put a lazaretto, even if you stayed more than 30 days. Quarantine is slightly different than isolation. Quarantine is used to keep someone who might have been exposed away from others. And here too, Avraham Kadlano wrote in his Olam Hafuch about quarantining. And he writes, Emmanuel Bono fell ill and buboes from bubonic plague were seen near his ear. Eliyahu Francisi attended him, and then Bono subsequently tragically died. Francisi was then quarantined. Then the wife of Menachem Minkin died. Her household was quarantined, and other people sadly passed away and their houses were quarantined. This is their experience with quarantine, as we today are experiencing quarantine for coronavirus. This is something which has struck the Jewish community like a dagger in the heart, closing our houses of worship, our shuls, our epicenter, the focus of our religious life. And they've been closed all across the globe. Is this something which has precedent? Well, actually, in London, again, in times of the Great Plague in 1665, even at the height of the Great Plague, the Anglo jury still kept its shuls open. But keep in mind, it was a very small community at that time. But what about other places? So here you have evidence that, in fact, there were other countries where synagogues were closed during times of plague. And here is an example of a work written in the 1500s when there was a plague in Venice, which killed 50,000 people of the almost a third of the population of Venice. And this Shmuel Yehuda Katznelbogen, the son of the famous Maharam Padua, wrote, Hesped Assisi b'Chatzer Get. He's writing a eulogy. He's printing his eulogy that he delivered, And he said, I delivered this eulogy bechatzer haget, in the courtyard of the ghetto, for this man named Zalman Katz, who was a resident of Mantua, Italy. Why? Because I couldn't deliver it in the synagogue, because all the synagogues were closed because of pandemic. And here you have an example of how people accommodated to this situation when the synagogues were closed or they couldn't come to synagogue. So this is an example, and this is a Chabad rabbi in the Dead Sea who's sitting in the courtyard reading a Megillah here to a man who is in quarantine, who's not able to attend the services. So he went to him and he sat in the courtyard. Even this we have precedent for. From plague, roughly around the same time there was plague in London, there was also plague in Italy. We have a work called Otzer HaChaim, written by Yaakov Tzahalon, who is not only a congregational rabbi and a tremendous orator to the extent that non-Jews even attended his speeches, but he was also a practicing physician in Rome, and he wrote Otzer HaChaim, which is a medical book. And in that, he writes about the plague and that transpired in 1656. And he writes, since the people were unable to come to the synagogue on Shabbat Parshat Toldot, 2 of Kislev, November 18th, 1656, Yaakov Tzahalon delivered a sermon at the corner of Catalani Street from the window of the home of David Gottini, and the congregation stood in the street below. On another occasion, I delivered a sermon on Tuscany Street in the home of a relative, Yehuda Gottini, and so on and so forth. Tzahalon also describes the restrictions which would sound familiar to us today. A lazaretto was established for the infected patients. Patients had to be put in isolation. It was not permitted for anyone to leave their homes except to visit a physician. At designated times, people were allowed to leave to obtain food. No one was allowed out at night, and if they were found on the streets, they would be placed in prison within the ghetto. And this might seem like a severe punishment, but behold the next punishment. People could not congregate together in the streets. What happened if they did? A gallows was built near the gate of the ghetto to punish those who violated this rule. Gallows. And here before you, you have a picture of the Italian ghetto. This is the ghetto of Rome. This is the gate to the ghetto. And this here is the actual illustration of the gallows, which stood in the 1600s and 1700s in the square right outside the ghetto as a deterrent for people congregating during the plague.
Dr. Reichman, can I just jump in for a second?
Sure.
A time when the Jewish community self-governed, and it was the Jewish community that built the gallows?
No, the gallows was by the secular community. So the secular community, Mendel, allowed the Jews to self-govern to a certain extent. They got to build their own lazaretto, but they had to adhere very strictly to the government policies. It's the government that determined the health policies. They let the Jews enforce them, but they supervised that enforcement, and they would send people into the ghetto to make sure that enforcement occurred. Even though there was a plague, people, Jews still have a tremendous desire to pray together, to join together in a minyan. And one of the interesting contemporary debates is whether you're allowed to participate in a minyan when you're on different balconies of a building, and whether that's considered together enough in order to constitute a minyan of 10 so you can actually pray. And it's fascinatingly one of the more debated legal issues in this time for us. And the rabbis all across the world are debating whether you can participate in such a minyan or not, excluding even the health aspect. One aspect is the health aspect. The other is from a halachic perspective. Is it considered joining together when you can see each other, but you're not in the same room, you're not on the same level? Is this something which had precedent in Jewish law? Here again, Reb Chaim Yosef David Azulai was asked a question, a remarkable question again from the 1700s. There were two groups of people who wanted to join for a minyan, 4 in one house and 6 in another house. Why couldn't they join together in one house? Because the 4 in the one house were living in this lazaretto. They were living in this isolation house, which had a guard which would prevent them from leaving. So they couldn't physically walk across the street and join these other 6 people to make a minyan. So the halachic question was, since they could see them, they couldn't physically join them, but they could see them, is that sufficient enough for them to join together to answer a Kaddish, to answer a Kedusha, to be able to participate together? And in fact, the Chidor of Rav Azlai said that it would be permissible for them to join together in a minyan. Synagogue and social distancing. I don't know what the situation is presently in the British Kingdom, but here in the United States, we have been allowed to open our synagogues, but only with social distancing. And here you have a remarkable picture of the Western Wall, where you have social distancing, everyone apart from each other, at least 6 feet apart. Is this something which transpired in previous times? And you will find remarkably that it indeed did, both informally and formally. So informally, we have from Avram Catalano's Olam Hafuch, which we mentioned before. He writes that we decreed in the ghetto of Padua that in order to maintain distance, i.e. social distancing between the people during prayer service, that the unmarried people should pray in the courtyard of the Ashkenazi synagogue, and those who usually pray in the Italian synagogue, who are now all praying together in the Ashkenazi synagogue, should occupy the women's section. So they wanted to spread out, to make it to socially distance. So for those of you who visit the city of Padua, the Ashkenazi synagogue is no longer an active synagogue. It has actually been transformed into the Jewish Museum of Padua. But literally a few steps down the road is the Italian synagogue. There are even examples of formal social distancing. And this is a remarkable passage from Rabbi Akiva Eger, one of the great rabbinic authorities of the early 1800s, from the city of Posen in Poland. And he writes, during the time of a cholera pandemic in 1830, "It is true that gathering in a small space is inappropriate, but it is possible to pray in groups, each one very small, about 15 people altogether. They should begin the shacharit, the morning service, with the first light, and then there should be another group right after that, and another one, and each one should have their designated time to come and pray. And the same should be true for mincha service as well." And he writes, because people wanted to push their way in, because everyone wanted to be part of a minyan, that you should perhaps use a guard from the police, from the secular authorities, to oversee this. What about using a lottery for synagogue attendance? And in fact, this has become a reality. This is an article from just a few days ago from one of the Israeli newspapers, that if you want to pray at the Western Wall for the holiday of Shavuot, you have to join a lottery. And if you win the lottery, you'll have the opportunity to pray at the Western Wall. Is this something that has precedent? And the same Rabbi Akiva Eger was faced with the following dilemma. We are coming up on Rosh Hashanah, Yom Kippur, and we're all debating how we're going to navigate this. So what were their guidelines? And really remarkable guidelines, instructive for today as well, from the early 1800s. They recommended that only half the seats should be occupied. Now today that wouldn't be sufficient, and their notions of contagion and the disease they were dealing with was a little different, but only half the seats should be occupied. Lottery should be done to determine who attends on Rosh Hashanah and who on Yom Kippur. So half the community would come Rosh Hashanah day 1 and 2, and the other half would come on Yom Kippur. These are some other recommendations. Davening should be limited to 5 hours in Rosh Hashanah, no recitation of any extra prayers, no additional aliyot to the Torah. The chazan should not prolong the service with tunes and chazanus. Of course, many people would like these guidelines even when it's non-pandemic times. A minyan, the physician and contagion. Again, returning to the 21st century, in the times of Corona, the question was asked of Usher Weiss in Israel. Can a physician who's working in the hospital treating Corona patients, and he wants to daven with a minyan, and it's okay to daven with a minyan, according to the government, can he walk into a minyan and participate? Or is there a risk of transmission of disease if he's walking literally out of the hospital ward of Corona? So he says doctors should not participate. Obviously, if they've washed and showered or time has passed, they could participate. But coming from the hospital, they should not. Here again, we have precedent. In the 19th century, during a cholera pandemic, a rabbi was asked. A physician came into shul and started davening, and he's a plague physician. He just came from treating a patient. And someone sitting next to him went up to the rabbi and said, "Rabbi, this doctor is a plague doctor. He just came from the house of a plague patient. Should he be davening in shul? Won't he infect the other members of the shul?" And the rabbi said, "You're absolutely right. this doctor should not be davening in the shul, and he should be davening at home. Visiting the sick. This is another work of Corona, HaCorona, Mal Magefas HaCorona. Visiting the sick is prohibited today when you're visiting Corona patients because of the illness that they can convey and spread to you as a visitor. It's a risk. Now turn your eyes back 250 years to a Bikur Cholim manual from Berlin of 1750. And the Bikur Cholim societies have been going on for many hundreds of years. And the Bikur Cholim societies of today are the descendants of these extraordinary institutions dating back to the Middle Ages. And in their manual they write, Kibalnu aleinu levaker kol choli. We as the Bikur Cholim society, we accept the obligation to visit all those who are sick, except those who have infectious diseases, which we as the Bikur Cholim visitors could contract. And they mention a whole number of diseases. And here I pulled out two of the diseases they mention. Pakin is one, which is smallpox. And this is a mem, mazalin, measles. So you're not allowed to visit if they have these particular conditions. We just have a few more, and we'll close and we'll open up for questions. Tragically, many people passed away during this pandemic. And to add to the tragedy, many people who wanted to be buried in Israel, for example, or wanted to be buried in cities far away from where they had passed, weren't able to get there by virtue of travel restrictions. So the question was, could you move the body, exhume the body, and rebury it at a later time? And Rav Schechter from YU said, in fact, according to halacha, it's the Jewish law, it's very clear, especially if you make a t'nai, if you make a condition upon the initial burial that you want to bury subsequently somewhere else, it would indeed be permitted to do so. And the same exact issues transpired before. This is from the Chatam Sofer, Rabbi Moses Sofer, from the 1800s, one of the great rabbinic authorities of that time. They set up specific cemeteries for cholera, and even in Europe, some of them are still extant. And he asked if it would be permitted to reinter from that cemetery into a family plot, and his answer was indeed it would be permitted to do so. Mourning practices during the COVID pandemic have altered tremendously. Here where I live, there have been so much loss of life. There isn't a single person that either hasn't had a family member close or distant that's passed away, or at the very least has paid a Shiva visit to someone who has lost a relative. And now we're all familiar with the expression Zoom Shiva. Many of these Shivas have transpired through Zoom. What was the situation in the pre-modern era? In the pre-modern era, they wanted to get rid of the mourning practices altogether during times of plague. The Shulchan Aruch, the Code of Jewish Law, says that during a plague, one does not observe mourning rites out of fear. And I've heard that some have adopted this practice. And we have records of many people over the centuries during the times of pandemic actually neglected to, not neglected, but refrained from observing laws of mourning. And here you have Malkiel Tannenbaum, Divrei Malkiel in the late 1800s confirming this. He said people do not observe mourning practices in the times of pandemic. And he said it's because of fear. But it's interesting, he said there's two types of fear. Fear number one is that you might contract a disease. There might be spread of disease amongst the mourners and those who are coming to comfort them. But he also writes that there's fear when there's so much loss of life, and you announce that there's so many Shiva observances, the people will realize that the pandemic is very severe, that so many people are dying, and it will have a negative emotional impact on the community. And that negative emotional impact will depress them and make their ability to fight disease much harder, and would cause them to possibly succumb to the disease if they would contract it. And so that was part of the logic, which I think is a tremendous human insight in there. And this is my my final slide, which I bring to you from the 1500s, which is a comment by a man named Eliyahu Davidas, who is a student of some of the great people in Jewish history, of Moshe Cordovero and the Ari, or great Kabbalists. And he wrote this, and I'll translate it for you, of course, but what's remarkable is that if I were to read this sentence today, it would be virtually applicable with no change today, and it would be as applicable today as it was some 500 years ago. And he writes, Magefa, plague, pandemic, epidemic, hi shlucham eito yizbarach b'avonosenu, mizman l'zman, is sent by the God above from time to time, possibly because of our sins. Asher yamus bo nar v'zokein, that in the midst of this plague, young and old tragically die, taf v'nashim, children and women, belisiba, without our understanding the reason. And in these plagues that happen from time to time, the physicians are confused, the physicians are befuddled. They don't know what's good in terms of treating the plague, what's bad in terms of treating the plague. They have no idea what's going on. And what is really remarkable is that in the 1500s, they genuinely had no idea what was going on in terms of bacteriology, virology, contagion, transmission of disease. We, in the 21st century, we think we know everything there is to know about disease. We understand that disease is caused by bacteria and by viruses. We have vaccines against disease. We think we should be able to control every disease across the face of the earth. But the objective here, and the take-home lesson here, is that really we all need to understand that the world is in the hands of God. And God brings this upon man to perhaps inject a little humility, that despite our tremendous advances throughout the course of time, it is still really God who runs the world, and God who is the ultimate healer. And this concludes the PowerPoint session, and I'll open up for questions. But I just want to conclude by saying that hopefully, with God's help, this will not only be the end of this pandemic and this plague, but God willing, we shouldn't see any more. And the important thing to realize is that we discussed some of the manifestations of these pandemics throughout history, but the Jewish community survived them all. And God willing, just as they have survived the previous pandemics with prayer and with introspection, so too we will survive this pandemic. And I think also we should appreciate that we are not alone in many of these issues, that ein chadash tachat hashemesh, there's nothing new under the sun. And many of the things we think are so novel about this novel coronavirus really aren't that novel, that in fact our ancestors went through many of the same things. So thank you for allowing me to join you today.
Thank you, Dutz and Dr. Eddie Reichman. That was absolutely fascinating.